your staff
I'm
on
sorry, could I have
any
an
issue.
answer to my question? I am concerned that we've got a pharmacy benefit manager here who competes with a bunch of America's pharmacies, and it's the one that is doing the pricing, and it's the one that's deciding who else the competition will be. That seems like, to me, a perfect way to be able to advantage yourself, disadvantage everyone else. And look, I'm not just making that up. I've got two pieces of evidence, $484 more per average.
Senator Elizabeth Warren of Massachusetts is not improvising here. She is not asking a loose political question. She is building a record. The program is Tricare, the pharmacy benefit for roughly 9 million service members, veterans, and their families. The contractor is Express Scripts. According to Warren, it helps decide which pharmacies enter the network and how they are paid. But Express Scripts also owns a pharmacy inside that same network. One company, two roles, public money, private control. Warren brings numbers: $484 more on average for certain generic drugs, and nearly 13,000 pharmacies gone from the network since 2022. Then she asks the Pentagon official the question. Watch what happens when the answer does not answer it.
With you and your staff
I'm
on
sorry, could I have
any
an
issue.
answer to my question? I am concerned that we've got a pharmacy benefit manager here who competes with a bunch of America's pharmacies, and it's the one that is doing the pricing, and it's the one that's deciding who else the competition will be. That seems like, to me, a perfect way to be able to advantage yourself, disadvantage everyone else. And look, I'm not just making that up. I've got two pieces of evidence, $484 more per average that we're paying now on these generic drugs, and 13,000 pharmacies across this country that have just said, you won't pay me enough, so I've got to leave the entire system, which cuts down on service for our military members. And are you telling me, oh, you're thinking about it? You've had 20 years to think about this.
The department continues to evaluate this budget. It reviews and works with the contractor to ensure that it's within the guidelines of the contract.
Well, you're working with the contractor. How's that working out? How do you explain $484 on average more for prescription for generic drugs?
Thank you, Senator. I'm not aware of the cost discrepancy.
Okay, then how do you explain 13,000 pharmacies actually leaving the whole system, just saying, you won't even pay me enough to make it worthwhile?
The contractor is meeting its contractual requirements.
Yeah, what? What are you saying about 13,000 pharmacies leaving this whole system, and they won't do they can't fill prescriptions now for our military and for our veterans? You're okay with that?
No, ma'am. Our priority is to make sure all of our beneficiaries, the 9.6 million, get the coverage that they deserve and the benefits they deserve.
Well, I think they deserve a lot more than what you're delivering for them, and I want to know when you're going to get better at this. Look, what we're talking about here is a blatant conflict of interest. Our job in this Senate subcommittee is oversight. And that's why it is, for years now, I've been calling for more transparency to ensure that Express Scripts isn't favoring itself and its own subsidiaries and under-reimbursing the independent pharmacies in the hopes that it can drive them out of the Tricare business altogether and just have more of the business for themselves. I have been met with obstruction every step of the way from our own Department of Defense. So let me ask you another question, Secretary Bass. Will you disclose the differences between Tricare reimbursement rates and fees and other price concessions between what it's paying pharmacies and what it's paying itself?
Yeah, thank you, Ranking Member Warren. I commit to working with you and your staff in providing the data that
You'll give me that data.
I will work with you and your staff.
I'm going to hold you to that. So Express Scripts' pattern of bad behavior speaks for itself. In addition to the news reports that I've already mentioned, an audit by the Office of Inspector General for the Office of Personnel Management found that Express Scripts overcharged American Postal Workers Union and the Federal Employees Health Benefits Program by about $45 million. And the Government Accountability Office found, quote, persistent inconsistencies in the data that Express Scripts provided to DOD, which DOD is supposed to be validating on its own, but failed to catch. So, Secretary Bass, given the long history of infractions by Express Scripts that I just read to you, will you commit to annual audits of the Tricare pharmacy contract to ensure that taxpayer dollars are not being wasted?
I commit to, yes, I commit to doing annual review of the contract.
Good. And then will you let us see those annual audits?
I commit to working with you and your
No,
staff.
will you let us see them? I don't want to hear about them and hear your summary. I want to see the audits. Do I have that commitment?
I will work with you and your staff.
Is that a yes?
Yes.
Good. Thank you. That wasn't so bad. Thank you, Mr. Chairman. I apologize for running over. I just want to finish up by saying the current Tricare contract with Express Scripts expires in 2029, and DOD right now is in the acquisition planning phase for the next generation contract. As it builds the requirements for this new contract, DOD cannot continue to ignore this conflict of interest that arises when a company owns both a PBM, that is the one directing the payments, and a pharmacy. That has got to stop. And in the meantime, existing contracts should be regularly audited and subjected to much greater transparency to try to beat this kind of conflict out of the system. I look forward to working with DOD on this and serving the best interests of the 9 million American service members, veterans, and their families who are depending on us. Thank you. I appreciate it, Secretary Bass. Thank you, Mr. Chairman, and thank you for the extra time.
The Pentagon's witness gives the answer institutions often give when the paper trail gets uncomfortable. The contractor is meeting the contract, but Warren is asking whether the contract protects the public at all. Those are not the same question. In the record, Senator Warren lays out the structure first. Tricare serves roughly 9 million service members, veterans, and family members. Express Scripts is the prime pharmacy contractor. According to Warren, it helps decide which pharmacies are in the network and what those pharmacies get paid. But Express Scripts also owns a pharmacy that operates inside that same network. That is the conflict. One company is helping manage the rules. One company is also competing under those rules. Then Warren adds the numbers. According to her questioning, Express Scripts reportedly charged the Department of Defense $484 more on average for certain generic drugs dispensed by an Express Scripts-owned pharmacy. She says nearly 13,000 retail pharmacies have left the Tricare network since 2022. She cites an Inspector General audit involving another federal health plan where Express Scripts allegedly overcharged by about $45 million. And she cites the Government Accountability Office finding persistent inconsistencies in data Express Scripts provided to DOD. That is the timeline she puts into the hearing record. A contractor, a conflict, a price gap, a shrinking pharmacy network, an audit, a GAO finding, a future contract coming in 2029. The answer from the other side does not close the file. Assistant Secretary Bass says the Tricare PBM is different from a normal PBM. He says it is an administrative services contract. He says the department controls pricing and retains cost savings. He says the contractor is meeting its contractual requirements. But when Warren asks about the 484 discrepancy, the witness says he is not aware of it. When she asks about the 13,000 pharmacies, he does not explain why they left. When she asks for transparency, he first offers to work with her staff. Only after repeated pressure does the record move from language to commitment. Annual review, access to the audits, a yes. And that is why this exchange matters beyond one contractor, because modern government often does not fail in the open. It fails through contracts, redactions, vendor data, technical language, and agencies that say the paperwork is compliant while families feel the damage in real life. A service member does not experience a pharmacy benefit as a procurement document. A veteran does not experience a network as a contract clause. They experience it when the local pharmacy disappears, when the refill takes longer, when public money passes through a private middleman, and no one can clearly explain who benefited. Accountability begins when the record becomes specific. Names, dates, numbers, files, audits, patterns, conflicts, commitments. That is what Warren forced into the permanent record. Not a soundbite, a paper trail,